Good day, everyone. We're from the Medical City Clark, and we're here to give you a good news on how we can work in partnership to be able to attain and sustain a healthy workforce for the company. As we all know, the Department of Labor and Employment recently just reinforced compliance of the OSH standards. And the good news is the Medical City Clark already has developed a program to address this concern and to align it with the company's policies. As I would quote our former president and CEO's words, to focus on core competencies and to outsource the rest to ensure operational success. Meaning, regardless of whatever industry you may be into, the thing is, focus on what is really the service offering of the company and allow us to take care of the healthcare needs of your workforce. With our clinic management program, our objective actually is we want to help you comply with OSH Law. Number two, we want to help you minimize your costs also on utilization for hospitalization and leaves of your employees. We want to help you have a workforce that is more productive through less absenteeism. Bottom line, we want to help you win operationally in your respective business. Okay, so what are the benefits that a company can be able to avail through the clinic management program? Let's discuss this in a nutshell. First, there's convenience in access to healthcare services at your own work sites because your employees would not have to go out of the office anymore for a checkup or something, but rather just go to the company clinic to see a doctor or to see a nurse for first aid treatment or a simple consult. Number two, there would also be ease in seeing medical professional because all these professionals are already in the work site, and it's just a matter of, going to the clinic for that. And you are ensured that all the medical professionals and allied medical professionals that we will be deploying in your company are all board certified and credentialed. Given that, okay, you can now focus on your core competencies because you would not have to worry on something that does not concern really operational excellence, but rather that part wherein you have to worry about the healthcare or health conditions of your workforce, that would be on us already. And then, given that the clinic management program is run effectively and efficiently, then you have an assured increased productivity and efficiency of your workforce. Lastly, with a healthy workforce, that will result to savings on healthcare benefit costs. Finally, we give you our commitment that by assuming shared responsibility and accountability for your entire occupational health and wellness, we guarantee favorable financial bottom line for your company. And now, to further discuss to you the details and pillars about our clinic management program, allow me to introduce to you our clinic manager of the Medical City Clark Ambulatory Center, Ms. Maureen Capuno.
Hi, good day. And as Ms. Ebong said, I am here to tackle with you the entire pillars that will support and strengthen our clinic management program, which will include the human resources, medication dispensing within the company clinics, physical setup of your clinics, preventive healthcare and health screening programs, medical record management. I will also tackle later on the health and wellness campaign for your companies, policy integration, and finally, the continuity of care. For the primacy of human resources, we will make sure that we will provide you board-certified doctors, Bosch-trained nurses, under the association of ONAP and the PCOM, or the Philippine College of Occupational Medicine. For the succeeding line, which is the medication dispensing, part of the job of the nurse or the Bosch-trained nurse is to ensure that we dispense or we provide over-the-counter medications to your employees to help them maintain their health, to prevent them from absenteeism, because while they are on site during their duties at the company, they can still be productive at work. For the physical setup, we have two cases where we can provide you the clinic enhancement, wherein some companies have their clinic in place. We will be there to help enhance the clinic setup in terms of the facility, medical supplies, and equipment that are all OSH compliance. There are minimum requirements by OSH that we will help you with. And then another would be the physical setup or the clinic construction from zero. We also know that there are some companies who have not yet complied with the OSH standards. So that's why we are here to help you also. Together with our team, we will go to your company, we will set up the clinic for you, we will make sure that the clinic setup is also compliant with our OSH law. Okay, and what about preventive care and health surveillance? Under the medical city clerk, we also provide annual physical examinations, be it on-site, meaning we will bring our manpower to your company, or be it walk-in. We have our ambulatory clinic where your employees can come to our clinic and give them or provide them the services needed for pre-employment or annual physical examinations. For the pre-employment, we also have the DOH required tests. We also have the, if you are within clerk, for that matter, we make sure that it is also CDC compliant. What are these basic tests needed? From the annual physical examinations, we can also do preventive care and health surveillance. We have this called the HPA, or the Hospital Provider Accreditation, wherein once you availed our clinic management program, you are automatically part of our HPA. And we have your, we will make sure that you are able to go to our emergency department at your ease through the facilitation of the medical city clerk from its company doctors, company nurses. And of course, we will also provide trainings. We make sure that the company doctors and company nurses does not end on undergoing their basic occupational safety and health training, or the BCom training, the basic course on occupational medicine. We also give them regular or update them with basic life support training, SFA or AED training, that will help them use these trainings to your companies. Okay, we also do have published rates from our partner hotels.
Yeah, but they get 50% discount from the published rates if also they become our clinic management program partner.
So to name a few, we have here our the
hotel partners that we have, yes. Wherein, you know, being a clinic management partner, whenever you want to go at least to rest, to relax, you can avail of up to 50% discount from published rates of our hotel partners, as you can see. And then also, for the executive packages, check-up packages, you can also avail of a 5% discount once the respective employee or management becomes a holder of our executive circle card.
Aside from our annual physical examinations and pre-employment, we also offer our corporate clients with the ECU packages. So, Ms. Ebong, what are the ECU packages all about?
Okay, our executive checkup packages, these are usually availed by, supervisory level up to management level of a company. And part of the benefits of availing this is once you avail this, you will be automatically be given, after your availment, of an executive circle club, which entitles you to certain or specific perks and privileges for you, not only for the manager or the supervisor, but it can be extended to their family. Especially the up to 50% discount that they can avail from the published rates of our hotel partners.
Okay, thank you, Ms. Ebong, for that. So aside from the annual physical examination, pre-employment, and ECU packages, discounts, on top of this, we also provide health and wellness campaigns. So health and wellness campaigns will be derived from the results of your annual physical examinations. So the significant findings that we filtered from your results, we will take action on this. We will correct this one through an event. This is to attract our employees to participate. One of the events that we cater is a one-day event, and then we do lectures, we do information dissemination, we do proper training or exercise that is related to your company, that is attractive to your employees as well. And then we also have the policy integration. We know that we have a shared responsibility on this. We also know that we need to comply on the previously signed implementing rules and regulations 11058, entitled An Act Strengthening Compliance with OSH, or the Occupational Safety and Health Standards, and providing penalties for violations thereof. We understand that we don't want to pay for penalties. That's why we are here. We are here to help you out. If there are some policies you need to enhance compliant with the OSH law, we will be there to support and align it with your existing policies. For the continuity of care, we also have a wide array of services, aside from the referrals. So we also understand the need to refer patients for further managements, be it results from annual physical examinations, or be it a pre-existing condition of the employees that are not being addressed before. So this will be referred to our specialty centers, and we also help them on their local and international HMOs and corporate partners. We make sure that you will be attended by board-certified specialists and subspecialists. And of course, we have this global network. We have this global brand. If you are from Clark, you have a branch company to outside of Clark, we will help you out to be referred to other facility. For example, our company or our ProSur clinics in the malls for your convenience. And we also have some nearby hospitals to other companies that we handle.
Thank you, Ms. Mal, for a very comprehensive explanation of the details of our clinic management program. But of course, that does not end there, because with the Medical City Clark, there's always a better change that we have to introduce to our partners. And again, we wanted to share with you, and of course, no less than Ms. Maureen Capuno again will give you this very exciting innovation that we have come up with for our clinic management program. Ms. Mau, take the floor.
Yes, thank you, Ms. Ebong. So we want to say goodbye to manual referrals. We want to say goodbye to manual dispensing of medications. We also want to say goodbye to manual phone calls of referrals. We would like to introduce also, as part of our clinic management program, is our medical records and operating system. This will be under our SDN, or what we call the Service Delivery Network. So what is this medical records and operating system is all about? So instead of calling our clinic or our hospital for a certain procedure, our company nurses will have this convenience of having this online registration or query. They will type in what is the needed service, what is the needed time and schedule, and it will be sent to either the companies, our clinic, or the hospital. So with this, we also ensure that we are able to monitor also the referrals, and it will not end on the referral only. Of course, we will also want to make sure that after the referral, is the patient was managed properly, is the patient was really seen. So through this, we have the convenience that a closed or a holistic management of the employees is being taken care of. Aside from that, other key features would be patient information and medical history. We also have the share notes and referrals. And we can also do e-prescription. For example, they don't have this certain medication in place, they can order from our hospital pharmacy if we have, especially for antibiotics. These are not really dispensed by our company nurses in the companies that they handle. And of course, integration to our HIS or the hospital information system in our hospital at the Medical City Clark. We can also give you SMS reminder for employees if they were given a certain schedule
for
for
appointment.
consultation or appointment.
Yes.
Even they are at home and they missed out the schedule from the company nurse on duty, they can check it with their mobile phone if the schedule has been set for them. And of course, data trends and analytics. We can also provide what is up and what is new in terms of healthcare management. And of course, audit trail. We can also do or generate report from that SDN, and this report can be feedback or can be fed back to the company clinics or the clients that we handle, and we discuss to them, for example, for a certain month, how many hypertensive patients did we cater, and so on and so forth. And from there, our company doctors will come up with programs to help our client or corporate clients manage these cases.
Thank you for joining us in this discussion, and just a special treat for today. Should you need further discussion with regards to our clinic management program, we offer you free assessment consultation. You can simply message us and schedule for a presentation meeting, and we would be more than glad to visit you in your company and come up with a custom tailored presentation specific to your company's needs. So, before we finally end this, allow me to leave with you a quote from the World Health Organization that goes, "Every dollar spent on wellness programs saves $3 in medical costs. Workplace fitness programs reduce short-term leave by up to 32% and increase productivity by up to 52%. In a nutshell, I'd like to say that, maintaining a healthy workforce should not be considered as an expense, but more so an investment. Good day again, everyone.